Greetings and welcome to the Health Data Ethics Podcast. I'm your host, Jenny Owens, and in this episode, I wanted to talk a little bit about my day job, the IT Business Relationship Manager, and specifically how this role can help eliminate barriers to health data innovation. One of the specific examples I wanted to discuss today was artificial intelligence or AI, but really these rules can be applied to any sort of technological innovation that you're trying to put into place in the health space. In my role, the role that I fill at Cleveland Clinic, so I'm a senior IT business relationship manager, which means that I sit between the IT division and the clinical institutes and try to facilitate conversations, advocate for needs in both directions. So, on a very low level, it means that I am talking with my docs and nurses about why their Microsoft is being updated to Office 365, why they can't have it on their personal cell phones anymore. And I'm also talking to IT about how we really do need to implement badge tap on these new ultrasound machines that we've purchased because our current workflow is laborious and it drops, the images half the time. A lot of times the caregivers delivering the actual patient care and the healthcare IT divisions, we find ourselves in conflict. We have the same goals. We all want to improve patient care. We all want to reduce burden on providers, and we all want to provide that care at lower costs. We often sort of butt heads though, because we simply don't speak the same language all that often. And that's really where the role of the IT business relationship manager, sometimes abbreviated as BRM, that's really where that comes in, as a person who understands and can speak fluently to both sides. This conflict is often felt in issues of innovation when somebody brings in a new idea that they think is going to reduce costs or provide better patient care, but they just can't get IT to sign off on it. IT won't just do it. And that's where the BRM can come in. So philosophically, the business relationship manager role is really, it doesn't have to be a BRM. There is a certification program that you can go through to learn and gain these skills. But really this BRM role is any role that leverages positive relationships to increase value in the organization. It's not limited to healthcare. You'll find BRMs in many industries. In healthcare, where we really find this role's value is in connecting leaders on the clinical sides, leaders on the shared services sides, places like clinical engineering, like pharmacy, and even leaders in geographic regions. So if you have a health system that's spread out across several hospitals, it's helpful sometimes to have somebody maintain subject matter expertise in just a single hospital or in just a single medical office building. That person then can connect those relationships with the relationships on the IT side, folks who are managing individual service line specific modules of Epic, the folks who manage infrastructure, your hardware, your software, enterprise solutions like Microsoft Office, literally down to the cabling in the walls, the strength of the Wi-Fi, all of the cybersecurity infrastructure that keeps us all safe, managing all of that and making sure that the correct people know how to contact each other and how to make requests and how to get those requests serviced. That's really the role of the business relationship manager. So this role really shines in a situation where a clinician has an idea for a technology solution for a clinical or an operational problem, and they're trying to get it through to IT. Because so often when we have a doc who has an idea, and they're good ideas, they're valid ideas, but they can't always make the effective case to IT for implementation. So just like to take a hypothetical example, let's say that I have a regular meeting with several of my clinician leaders. This is a hypothetical example. This is not something that actually happens at Cleveland Clinic. And one of my docs has just returned from a conference where we had a bunch of vendors who presented technical solutions for digital documentation support, right? That's a really hot area right now in the healthcare space. Everybody wants to take a microphone on your cell phone, listen to your conversation, spit you back a note describing everything that you did with the patient, and then you can just edit that and sign off instead of having to dictate or type your entire note for your ambulatory encounter. So our hypothetical clinician, very frustrated with the time spent responding to inbox messages and patient encounters, feels that these vendors are able to help. And the first thing the BRM is going to do is going to sit down with that consumer, right? If you think about this in a business model, right? The clinician is a consumer of healthcare IT products. So we're going to sit down, we're going to understand what is it that the consumer actually is asking for in this case. And our doc is going to tell us that inbox messaging takes up too much time, note writing takes up too much time. We're going to go with one of these vendors. I don't care which one, just do it. And it will take 30 minutes and solve all of our problems. So the BRM is going to take that description and shift and massage it into IT speak. So this problem, as stated, is overly broad, right? If inbox messaging and note writing takes up too much time, how do you define too much time? What's the right amount of time for it to take? The proposed solution, just implement this. This is vague, right? What does this actually mean? There's a lot of vendors in the space that offer very similar products, and especially in the artificial intelligence space, a lot of these solutions are the value that they delivered is heavily dependent upon how they are implemented, the training that is given, and how you are measuring their impact. So without a BRM involved, this idea might kind of die on the vine, right? It's a good idea. It has a lot of value, but without somebody to help a clinician make the case to IT that this is going to bring value, it can kind of swirl, right? So BRM's next job is to flesh it out, put this into IT speak, and then take it to the appropriate channels to make sure that ITD actually gets a chance to look at it and evaluate it. So a BRM might add important details such as, what does too much time actually mean? They might say, ooh, over the past 5 years, we've increased our time spent responding to inbox messages from patients. We've increased our pajama time that we're spending doing note documentation outside of work hours. We could use a tool to draft responses to these inbox messages and to draft notes for patient encounters. And that might reduce the amount of time that we're seeing here. That would reduce provider burnout. It should maybe, in theory, reduce provider turnover. And it would definitely reduce the amount of time that we're measuring on these things using several pre-existing dashboards that are already available. A BRM would also look at the vendors. They would expand on, hey, what are their capabilities? How does the implementation work? Do they need to be fully integrated within our electronic health record? Do they need to be integrated within our IT infrastructure? Or is this the sort of thing where, you talk into a microphone, you send it out to a cloud service, it pops back a transcript and then a draft of the message or of the note, and then you copy and paste it in. So it's all kind of running kind of in parallel. This is the kind of thing that a good BRM can do for your idea. And it's part of the reason why I really do believe in the value of the business relationship manager program and the role. It is really helpful to have somebody who is relatively fluent and understands, the nature of the service line that they serve, as well as the internal structure and the nature of the IT division that they serve.